endometrium or 1A into the vagina, these are almost never treated surgically. This is partly because it's hard for us to get negative margins, healthy tissue edges around the tumor, but it's also because the chance of the lymph nodes being involved is so high that surgery becomes much less effective as a way of treating the cancer. And then the most advanced tumors are the stage 3s and 4s. The stage 3 includes the extension of tumor all the way to the side wall of the pelvis. This is the patient who presents with that sciatic pain, where the nerve has become entrapped with tumor and it hurts. So this is what we would hope never to find in our patients if they're being screened well. We would hope always to find the disease before it becomes cancer or when it's a very small cancer, because that's where our successes will be. And then the stage 4s are those where spread has now moved out of the lower genital tract and into the bladder or rectum, or in the case of distant metastasis, could end up in the lymph nodes farther away. So management for invasive cancer is the same for most situations, whether the cancer is squamous or whether the cancer is glandular. There are a few exceptions, which I'll talk about. If the cancer is stage 1A, this is the 3 millimeters deep, 7 millimeters wide, we could offer cone biopsy alone if our patient desires fertility. And this was very nicely discussed this morning. If she does not desire fertility, a simple hysterectomy, such as a vaginal hysterectomy, is very effective and is a fairly non-invasive way of treating the cancer. If the cancer is bigger, meaning a stage 1A2 or a 1B1, historically, this meant doing radical hysterectomy. This is very effective. Most patients will be cured, but they will, of course, lose their fertility. And so the talk this morning mentioned trachelectomy. I'll give you a little bit more information about that because we are doing trachelectomies in the United States, and it does provide some nice options for patients. And then finally, the most advanced stages of disease are no longer treated surgically, but instead are treated with radiation and chemotherapy. And our likelihood of cure falls substantially. So everything that we talk about in this entire meeting, all 3 days, is really about how we can try and prevent the patient from presenting to us with advanced stage disease. Anything we could do with vaccination, with screening, with early detection to prevent it from getting that far along is to the benefit of our patients. So let me talk a little bit more about microinvasion. The talk this morning at the beginning of the day was on microinvasion that is squamous in nature. The principle is that if the disease is only small in volume, just beginning its invasive process below the basement